Hello, good afternoon. So we are live on Dr. Ravikant Patil Facebook page, official Facebook page, as well as the YouTube channel of Dr. Ravikant Patil. Thank you so much for joining for different part of the world, and this is very innovative day, and we are talking about cardiac longevity soft launch. I would like to request Dr. Ravikant Patil, thank you so much giving your time, and we will start our session if you permit to start the session.
Hello, hi, Dr. Anil. We can start the session, I think.
Okay, thank you. So most of the people are joining from Africa, different part of the world, Dubai, and what is the there? Everyone is asking me about what is the cardiac longevity? What is your objective about that? So we have create one video that is the intro video, and that intro video you can understand what is our objective exactly. So it is a journey we started from last 5 years in Dubai, and Dr. Ravikant has experienced almost 25 years in this industry. So this experience and what is required for in today's era in healthcare, how this dynamic is changing. So related that our team is continuously working on that, and today is the day on 30th April. I would like to just inform that this today's Dr. Ravikant birthday as well. So this is the right time to launch such kind of innovative program, and I would like to share that video about the cardiac longevity soft launch, and after that Dr. Ravikant will explain about what is the objective behind the cardiac longevity and how we can take it this further and how it can be useful to reduce the burden of healthcare. And our objective, our mission is to make this destination heart disease free. So that is our vision, that is our mission, and we are taking. So cardiac longevity center from Dubai, live from Dubai, live from India, live from Africa, and different part of our associate and partners. Thank you so much for joining. Might be you are not able to interact with us, maybe on Facebook, on YouTube. You can just put your messages, and then we can take your question if you have any question. So I'm just sharing the our intro video, and then after that you will come to know what is our objective behind that. Just give me 1 second. It's loading. Thank you so much. I can see most of the people are joining here, and we keep it live because most of the time people will don't have a time, so anytime they can see, it will be available on our official Facebook page, and it will be available on our YouTube channel and all other Instagram account. So here we go.
Often, the very first warning sign of heart disease is a sudden, catastrophic event. The muscle seizes, the system fails, and a patient goes from seemingly healthy to fighting for their life in seconds. This happens because traditional healthcare operates in a reactive trap. We monitor the patient, wait for a physical breakdown, and only then do we step in to attempt a medical fix. A patient might see their doctor once a year for a routine checkup, but in the 364 days between those visits, they are entirely isolated. Their daily diet, their stress levels, and small physiological changes go completely unrecorded, creating massive blind spots in their health data. To actually survive heart disease, we cannot rely on arriving at the emergency room a few minutes faster. We have to eliminate those blind spots and map the physiological risk before an event ever has the chance to occur. Now imagine a different model. A system designed to ensure the UAE, and eventually the entire globe, operates completely free from sudden, preventable cardiac failure. Reaching that level of longevity requires dropping the reactive model entirely and moving to a prevention-first strategy. We already have the clinical research and the medical knowledge to stop these events. The actual barrier is the lack of a continuous connection between a patient's daily life and their medical team. Right now, the data simply stops at the clinic door. To change the final outcome, we have to digitize the entire patient experience, building a permanent bridge across the gap between those annual checkups. That bridge is the Cardiac Longevity Center Webportal. Launching now, this platform acts as a 24/7 digital link, permanently connecting patients directly to our board-certified cardiologists. This animated diagram illustrates how the portal works as a data funnel. It takes scattered, isolated points of information, like lab results, genetic profiles, and daily lifestyle inputs, and synthesizes them into a single, dynamically updated metric called the cardiac risk score. From there, the user experience is designed to be frictionless. Patients bypass phone queues, book screenings in under 2 minutes, and securely message their care teams. These tools deliver a measurable quantitative impact. By integrating smart alerts and continuous tracking, adherence to prevention programs improves by up to 40%. The portal shifts the patient's role completely. They are no longer a passive subject waiting for an appointment. They are now an active participant in their own health journey. But the web portal is just the foundational infrastructure. It sets the stage for an even larger ecosystem, our upcoming Phase 2 smart device application. See the real-time, two-way data flow running directly from a patient's wearable smartwatch through the mobile interface and straight into our remote clinical dashboard. This continuous stream activates other services, enabling real-time diet adjustments, instant telehealth video consultations, and routing data for rapid second opinions. Crucially, the app includes a dedicated emergency access protocol. If vital signs cross a critical threshold, the user has an instant link to a medical professional when seconds matter most. By putting a world-class cardiologist directly in the patient's pocket 24 hours a day, Phase 2 closes the reactive trap for good. For the patients already testing the system, the impact is deeply personal. They describe trading the constant fear of the unknown for the genuine empowerment of a continuous connection. This unified data model also extends outward. Referring physicians and partners gain access to a dedicated dashboard, allowing them to view shared care plans and seamlessly coordinate treatments across different providers. By integrating these systems, the UAE is establishing a data-driven model for preventive care that bridges the gap between the clinic and the home. The core mission is simple. We are moving medicine from treatment to prevention, ensuring individuals live longer, healthier lives. The invitation is open. Join the movement toward better heart health and take the first step into the future of cardiology.
Thank you. This was the objective. So you got clear idea. So we are working now. Today we are launching our portal, informative portal, and then second phase we will launch our mobile application. So I would request Dr. Ravikant sir, so he can start with this presentation.
I thank you. Thank you, Dr. Anil, for this kind introduction. And it has been a very, very good journey since last 3 years when I started coming to UAE and Dubai and started working as the cardiologist. I came there to do a lot of angioplasties and TAVIs and other things. But then when I went to Dubai, I saw the main gap is the treat not only a treating the disease is to preventing a disease. There was very few activities were done in UAE for the prevention of a heart disease, and there's a minded very big uh, gap there because there is a population who is at stress. There's a lot of expat population who are staying away from their homes, who are working continuously, who requires really to understand about the prevention of a heart disease rather than treating them in that activity. And also, I came across with a lot of European, American, other patients in the world where they were fascinated by the idea of a longevity, but there was nothing which was available in the field of a cardiac longevity. Because when we say longevity, the thing is we want to live longer. But how will you live longer if your heart is not healthy? Your heart is not proper. So to make your heart healthy, we have launched a program called as a cardiac longevity program, and in turn, it will increase the longevity of the overall population of the world. So next slide, please. So, as a cardiologist, we always see patient only in a crisis. The moment they are into angioplasty, moment they are having a chest pain, they are collapsing, they get severe profuse sweating, and those kind of the activities, they come to us. But then it is just a reactive treatment. We are not able to give them what actually will save their heart. 50% of them will actually lose the heart capacity, and 50% of them will die before reaching to the hospital. So let's save the heart rather than treating emergency. So from a reactive care, we need to go to a preventive care. That was the whole ideology. Next slide, please. So, see, this is the tip of iceberg. What we see as a cardiologist: heart attack, stroke, emergency, chest pain, everything is a tip of iceberg. What lies beneath is a hypertension, there is insulin resistance, there is obesity, people smoke, there is a lot of physical inactivity, stress, there is unhealthy food habits, metabolic imbalance, there is a delayed straining. All these things happen when we stay places which are away from our home. The places in UAE where the most of the expats are going into this kind of a vicious circle, and then they present only when there is a heart attack. But then unless until you treat this, all these risk factors, there's no point in just treating the heart attacks. Next slide, please. So the too late intervention is the point. That is the point where we thought of getting into a cardiac longevity and offering something like a cardiac longevity. So there is a silent risk accumulation for almost 1 to 15 years, which causes a microvascular damage, which causes the major arterial blockages, and then the reactive care begins when there is a real chest pain and there is arrhythmias and the patient is at the deathbeds. Next, please. So when we differentiate reactive model from the longevity model, what are the different things? What are the important things we are looking at? So the trigger when in a reactive model is basically appearance of the symptoms. We are not treating at the risk factors, but we are treating at the appearance. We are approaching the patient, or patients are approaching to us as interventional cardiologists when there is an appearance of a symptom. But then intervention timing is either very late or only in emergency stages. And what is a metric of a success? We just see that patient will be saved. We need to save the patient. We need to keep him alive and not exactly to give him, or we are not in a position to give him the normal intact heart because the patient is already reached late to us. So what becomes a patient's role? The patient's role is just shifts to a passive receiver of a care. And that is the whole point. When we go to a longevity model, we predict the risk profiling. We see patients approach to us when they are not still into a risk factor phase and they have not got any heart kind of a heart disease. We can do a early and continuous optimization. The uh, uh, the idea is whole risk factors should be detected early, and there should be something which can monitor them on a day-to-day basis. So most of the times I have seen that we can see the patient, we can see what is the preventive therapy should be applied, what are the risk factors we identify, we tell the patient. But unless until we follow them, unless until we have a continuous monitoring of the patients, because the risk factors, risk profile is again something which is not in a continuous basis, because even the patient has got a risk factor for 10, like diabetes, for 10 to 20 years. Most of them will not have any kind of a heart disease because they are very well genetically monitored. And some patient who has got hardly 1 or 2 years of a diabetics, if the genetics is bad, the basic family history is bad, they can land up into a heart disease within a year. So the metric becomes the continuous optimization. The metrics becomes the continuous observing the patients on this basis, and there where comes the cardiac longevity center. So our metric of a success becomes the quality of a life, and then we treat them. So cardiac longevity creates the condition of a heart where the condition of the heart remains healthy, efficient, and resilient for as long as a longer period. So this is very important, that keeping the heart condition normal, the keeping the heart condition uh, like a functional capacity, the quality of a life is mainly the goal when we talk about the cardiac longevity. Next, please. So the six foundations of the cardiac longevity, number one and most important becomes the early detection. You screen BP, you do a lipid imbalance, see the waist circumferences, stress and strain, and then we have designed a tool which Dr. Anil will show you after this presentation how we can detect this. It is AI-enabled drill which can give us the early detection module. Then we will personalize the risk stratification. What is this personalization means? Like if you have a hypertension, there are 30 medicines which are be given to a hypertension, which will suit you best. I cannot treat your hypertension like your wife. I cannot treat your hypertension like your father or your friend, because you are genetically different person. You have got a different kind of risk factors. Your whole quality and the whole personal life is different. And in this time, if I want to personalize your treatment, that will give you the better result, and it can prevent us from the longer uh, kind of a cardiac intervention. So the spotlight is the silent driver. The silent driver is the brain, the heart, the arteries, the kidneys, everything. The atherosclerotic heart disease can affect all of them. It just does not affect the heart. It affects brain, it affects arteries, it affects kidneys. And then we need to personalize exactly what kind of a disease you have and then treat you accordingly. Next, please. So, in a Dubai context, the urban stress is very, very high. We have got a modern city pressure. It is one of the modern city in the world, one of the highly strained people, one of the highly active, highly ambitious people stay in Dubai, which leads them to a very, very high stress. There are long working hours. There is desk bound and sedentary lifestyle. Sometimes there are frequent travels and disturbed sleep. People transfer, people travel in different continents from Dubai. People come there from the different continents, and then there is eating out frequency also. All those things leads to a difficult cardiovascular response. That all those things leads to a metabolic imbalance, weight gain, pressure spikes, and then it can lead to a cardiovascular disease. So there are two pathways in this patient journey. What we are doing at the cardiac longevity is the second pathway. The first pathway is you have a heart disease, you have a risk factor, you ignore the symptoms, you don't do a checkups, you land up into emergency events, we do a surgical intervention and try to save your life. But then I don't know what's will going to happen to a quality of a life. But then if you have proactive awareness, we do executive screening, we do early detection, we reduce the risk, we do a regular follow-ups, and that causes a fantastic quality of a life, and the best life what we can give as a quality, and just now the quantitative life what will you have. Next, please. So the longevity ecosystem has a physicians and clinics. We have the preventive cardiologist. We have the collaboration with the different GPs and the referral models. We can also collaborate with the communities and the families. Family has got history-based risk identification. There is a community awareness need to be done. There are workplaces where this high quality of stress is affecting the people, like corporate wellness partnerships and the structured screening pathways, and all those things we are binding with the technology, and just not a OPD practice, just not a IPD practice, but taking in a technology to have a continuous monitoring of your heart disease, of your heart health. And then we will design a program for you with the continuous monitoring, which will prevent you in going into a early collapse. Next, please. So my key factor for you is do not wait for a symptoms to respect your heart, check your blood pressures, understand your risk factors, know your numbers. You should act early and follow up regularly. That will lead to a higher cardiac longevity. So the core architecture of cardiac longevity is one that heart disease develops silently over many years. The reactive care is essential, but prevention must start earlier, just not act when the symptoms start. Focus shifts to preserving a long-term heart health and the function, and just not only into survival. The master key is a detection of a hypertension and diabetes earlier. The four pillars of the cardiac longevity is lifestyle screening, risk stratification, and follow-up drive of longevity. And the ultimate goal is just not to extend a life, but live a healthy and active years of living. And that's how the cardiac longevity will help you just not to survive, but to live very, very healthy. So summarizing all these things, the best cardiac intervention is not always the one which is performed in emergency. Sometimes it is the risk identified early, the blood pressure controlled on time, Lifestyle corrected before damage begins and the patient educated before disease begins. And this is what the promise of a cardiac longevity. And I think this is what we need to achieve in Dubai. Thank you, Anil.
Thank you. Thank you so much. This was a wonderful presentation. Many insights are there about the cardiac longevity. There is one more section we are starting through Cardiac Longevity Center that we are encouraging all the key stakeholders, whether it is a GP clinic, wellness centers, and those have don't have a cardiac department. So the cardiac longevity team will help them to develop the cardiac longevity department in their section, their premises as well. So that is a good opportunity. So now the time has come to just officially inaugurate our website. So before that, I will just share some few points in point of view, patient point of view, partner point of view, and the government and the compliances point of view. So I just would like to highlight, how minor details we have considered, from the data compliances, from the patient safety, from the opportunity for the partners, how they can grow in the business. So that's I would like to share in a few slides. Then we can go through the exactly live slide. So there already doctors mentioned about that we have the focus entire application, entire web portal is focused on the prevention first, then personalized care, because you already mentioned that one medicine cannot be applicable for all patients, even your family also, the heart is different. So the personalized care, and again, it's not about the any alternative medicine or complementary medicine or anything. So this is just about the evidence base. So we are focusing on the evidence base. See how exactly this CLC portal will work. If you see now, as of now, the information, the patient details and everything, you can see on the that website, and that through the website, those patients required our services and required the treatment from the Dr. Ravikant Patil and the our team of cardiologists. So what they will register over there. They will get their unique ID, and that through unique ID, so what we will do, we will monitor them online. So monitor with their BP machine, monitor with their wearables, whatever medical devices they are using to keep their heart healthy. That is we are doing. So as of now, we are launching the web portal. The second phase, we are launching our application, but we will give the heads how we are going to do it, because we want all key stakeholders should give their feedback, and then we can start the good moment for the heart care. So so this is our application. This is the monitoring application. Continuously monitoring will be there. There will be vitals. There will be their BP. There will be and again there will the panic button, SOS, whatever emergency. If they require any information, they can even dietary guidance also. As soon as we will track their each and every data, as it's already in the video. You show that data is lying on the door of the clinic and hospital, but it's not. They are just coming for the every quarter or every 6 months or every year for the checking, but what about the every day? So this is the one application. It will track your data every day, and something goes wrong, immediately it will identify your cardiac center and the cardiologist, and then cardiologist you can have the direct online consultation with the even if you want to take a second opinion as well, you can take the second opinion. Again, if something goes, because it's the golden hours, it will take time immediately in that situation what to do. So if there is a emergency protocol, they can just click the button and we can save a lot of life through this simple application. We want how they are logging it. There for three types of login. One is for the patient, one is for the doctors, and one is for the corporate. So what we observed in UAE as well, most of the people, most of the employees, they are suffering from the stress and the heart problem. So we are conducting the corporate wellness inside the industry, inside the big companies from 50 to 500 employees. We can screen, we can create their dashboard. So the employees, the organizations can understand how many their employees are suffering from the heart disease, how many they are hypertensive. So this kind of entire ecosystem we have developed very well. Again, genetic hub also we are creating. We are doing the cardiac genetic test as well. We are associated with the many UK based companies, Indian based companies, and we are giving the best result in a minimum time. So already doctors mentioned about the continuous cardiac loop, that is covering, you have to register. Then we will do the risk assessment, that is a free of cost. You have to just simply answer the question. I will show you the live. Then we will create a care plan. then we will track and engage and then follow up. That cycle will continuously. Then uh, uh, like your heart age, how long you have to live. So it's not matter about the how long you can live, how healthy you are living. It's that is our main objective. So what is our plan to roll out the launch? So quarter two, what we are requesting again, all the key stakeholders, please give their feedback. Those are the board members, those are the CEOs of the hospital, those are the non-interventional cardiologists, interventional cardiologists, GPs. Most of the GPs in the if you see the hierarchy, the GP is the first person who is handling the patient. So we are taking all their feedback. We will put all your feedback in the application, and then we will do the physician onboarding. It is a location wise also. We can identify if you are living in Udmeta, you are living in different part of Alkises or different part of the world, and you want to know which are the nearest centers where I can do all the testing. You can look at the geolocation as well. We will start with our existing around 500 patient already there. So we enroll this 500 patient. We will track their data according to compliances of UAE, and then will be the complete public launch application will be it will be soon. So what is the next? It will the mobile ecosystem, then AI health insights, whatever questions related to cardiac, you can ask. The machine learning system will give the exact answer. It is not developed by engineer or any AI tool or maybe chat GPT. Those are the experienced doctor like Dr. Ravikant Patil. Those have 25 years of experience, and doctor is associated with the UAE Cardiac Association, then World Health Federation. There are the n number of American Heart Association. These are the big organization. We are in communication with them how we can make the best at best to make the destination heart disease free country. Again, genomic profile also we are planning to do through this mobile application. So today is the day we want to start that, and then uh, so now I just want to Dr. Ravikant sir just come and say this officially it started now, and I will open the website, the portal.
So, friends, the Cardiac Longevity Center, our portal or website, has officially started today. It's a very auspicious day, and it is a very important day in my life that after coming to Dubai, we have innovated something new which Dubai didn't had then, and it will be our first brainchild. And I request all of you to take advantage of this uh, idea, and we will work together to make Dubai completely heart disease free country.
Thank you, sir. So this is the our home page, entire web portal. You can see that there are different nationalities. 120 nationalities are living in Dubai. So our theme line, our punch line is the early detection, okay, screening, personalized long-term care. Want to protect your future before the system appears. That's and when you click here, explore the heart program, you will get the different program that I will show you. Again, prevention is not about just individual. It's about the family, corporate, wellness, the prevention with the precision, and you can directly book the consultation over there as well. This is the application where application you already mentioned about in the presentation. There are the directly called to the cardiologists. There are the different parameters already mentioned there. This is the very unique. Again, nowadays is only misinterpretation as only the males are getting the heart attacks, females are not getting the heart attack. We want to think about the woman health as well. So we are just redefine the art and science of heart care. Again, this is the very future, and we would like to start the future with us. And this is our complete website. You can see there the online consultation, cardiac packages. If you want information about the expert, these are the all information you will find it. It's upgrading. You can see the cardiac longevity program is there, cardiac packages are there, safe angioplasty. I will share one video about the testimonials about the one patient from Sri Lanka, patient from the Philippines, patient from the Africa, patient from the different part of the world. Dr. Ravikant has already treated them, and their feedback was wonderful. Here this we want to educate. It's not about the treatment. We want to educate the people also. So what is the hypertension, why it's come, what is the life modification you can do. You can just click over there. So it is a single window. Don't no need to go Instagram, no need to go YouTube, no need to go anywhere. Just simple cardiac longevity center related to heart, you will get everything. It is a encyclopedia about the heart care, and you can see the patient real patient testimonials as well. We are giving the different articles, different facts and figure about the cardiac care. What is a cardiac longevity? If you want to learn in details, you can learn through this page as well. So this is only one page. You can see all the details. There are different pages are there. This is wonderful. You can do your wrist test, heart wrist test. So it's very simple, AI driven system we put. Like for example, I'm putting my this thing. So under 35, I did the 1 year ago. I don't have any diabetes, no smoking, just low physical activities there. And I want to check my heart risk. It will show, oh, it's good, low risk. But it's giving the same time, so you can still go for the smart heart screening. For example, those 40 to 44, that age bracket, those have diabetic, those have family history, those have high stress, and again the low physical activity. Let's check them. So what we are doing in a 2 minutes, 8 risk factor we can understand, and instant direction what you have to do. Then you can click here. It's live now. You can check on your phone also. Then it will be in a high risk action recommended. So your response suggested higher cardiac risk profile because he has a family history, diabetes, hypertension. Then complete heart checkup is strongly suggested. If you click there, automatically you will go to the our WhatsApp, and our team will help you there. So this is the way we can have. And again, the cardiac longevity. What about the cardiac longevity? There are the different packages also over there. So these are the packages. You will feel like you are on the Flipkart. You are doing the shopping unnecessary most of the time on Amazon, Flipkart. If you want to give gift to someone, you can come to cardiac longevity center, and you can give this gift to your loved one, like smart heart screening, advanced heart screening. Most of the times we are giving gift that is not useful, but now we have understood that people are giving on their Valentine Day, or maybe Mother's Day or Father's Day. So this is the real gift, and their bonding, who's are care about their loved one. So we can give that gift to them. So you have to just add to cart. You can view the cart, then it will show. So those are the packages around 2500 dirham. So we are giving just only 700, and we can cover what is the cover there. ECG, digital pulse analysis, SOZA India, SOZA Dubai and SOZA India working together for the digital pulse analysis, where you can understand your heart age as well. ECG there, HbA1c, CBC, troponin I generally only in emergency people are doing, but we are doing in our packages as well there, and consultation with the cardiologist. So, and then just you have to add this card and do them like how generally you are doing for the check out all this process. It's a simple process. So that's very user friendly. You can view the card, you can just proceed with the checkout, your order will be there. You have to just book your appointment, and then our team will take care. So each and everything, sir, we are again about the health condition, we are creating some article blogs in collaboration with international cardiologist. And then definitely we want to I already mentioned that is our vision, to make this destination heart disease free. So this is, I would request each and everyone, go on the our portal, and then give your feedback. Definitely your feedback, it's important to develop is more and more. And now I just sir, there are the some, already we are associated with the some of the countries, and they want to share their message with us. So there's a, there's one partner from Africa. He want to share his view, so I will just share his thoughts. So he's giving some message.
Hello, my name is Dr. Onana Pole Dubo, and on behalf of the team at Alpha One Healthcare Solutions AHS, I want to extend our warmest congratulations to Dr. Ravikant Patil and the entire Cardiac Longevity Center team. Now, we want to express the fact that we truly appreciate the launch of your new platform, which is focused on preventive heart care. This is such a timely and a meaningful initiative for our society today. And we believe that you are highlighting the things that matter most, which is early detection, public awareness, and I think more importantly, or very importantly, personalized care. This is an initiative that helps people think about their heart health, okay, which includes the how, the before an emergency happens. And we want to send our very best wishes for the success of your web portal and your larger mission, which is to save lives. I want to say that to the entire team, you have our full support and our encouragement, and we're looking forward to partnering with you to see how this your platform is effective in Africa. So I want to say big congratulations, and we wish you all a very happy launch. Thank you very much.
Thank you, Dr. Paul. Dr. Paul is live, I think, on YouTube or maybe Facebook. So thank you so much for your support. Definitely in Africa we will start soon. So we have a result. Ellen, doctor was mentioning about the safe angioplasty, and this is the one of the evidence.
Start.
Yeah, my name is Suranga Kalum Samira from Sri Lanka. Actually, special thanks from bottom of my heart for the doctor, because after this before treatment I have the chest pain actually. I have some difficulty to breathe as well, but after treatment I feel like 100 plus. I'm very okay, and special thanks for the doctor, sir.
Great.
So actually, my friend has a 99% block in circumflex, and it was a near total occlusion. It's a calcified artery. So what we do in a safe angioplasty is cross the wire, to choose the right wire, to put the right stent and put the right kind of a balloon. So that what happens is you will not have this kind of a symptoms again, and the disease will not recur again. And best of luck, and good luck for your life.
Thank you so much, sir.
Thank you. And there was one more person. The last, I think there are many already, but considering the time, so there's one our partner from Dubai would like to share some.
Hi, this is Dr. Priya from Sousa, wishing you a very happy birthday from myself and Sousa team, and congratulations on the launch of Cardiac Longevity Clinic. Cardiac longevity aligns strongly with Sousa, as we also do cardiac longevity test, where we exactly know how far someone is from a heart attack, and we also give them the biological age of their heart. This platform is very dear to our heart because it aligns with the vision of Sousa. And congratulations for promoting, as a cardiologist, promoting preventative health and cardiac longevity. Best of luck on the launch, and cheers to the amazing work you have always been doing across your life. Wishing you a very happy birthday once again from myself and our team. Have a great day ahead.
Thank you, Dr. Priya. As always, we want to go together, and that is the beauty. When we are in UAE, we are treating almost more than 120 nationality. It's a patient again from the.
I am one from Sri Lanka. That whole proceedings went very well. I must thank Dr. Ravi Khan and you, Doctor. Thank you very much.
Thank you. So thank you. So many messages coming here. Dr. Ravi Sang, thank you so much, sir. Hearty congratulations, Dr. Ravi. Bharat More. There are many names of the Dr. Rahul, Orena, Dr. Ravi Khan, Orano, Dr. Paul. There are many messages coming. Thank you so much, Mr. Ravi. Ravi sir, always our guide, philosophers, and he's helping us. And very soon we are launching some program with him about the awareness and the CMA, especially for the GPs and the cardiac longevity. Ranjit sir, thank you so much. Many people are giving the message. Dr. Madhuri Savan, Shivtal, Anil Mane, Amay Pallavi, Padmakshi Lokesh, Sri Kannan. Sir, you want to say something? All these people just. Many people are there, almost more than 50, 60 people, and
Thank you very much
divided.
for the love you have shown to me. Being in Dubai only for 3 years, and that's also only a part-time basis. You have become my extended family. I really love all of you. Thank you very much.
Thank you, thank you. And just now, the last we how we started, we want to share with the one last video. And then again, I request you, please go through the portal, give your suggestion. It's not completely 100%. It's just a testing phase now. And whatever your suggestion, with your suggestion, will come back. Mr. Sahil Patil, our IT core team, he is also working on the application. So your feedback is also important. So thank you again, our cardiac longevity team, the research team who already working on it, the IT team, and the all patient care team. So all the teams, those are directly and indirectly engaged with this project. Thank you so much. And this is our journey. I would like to conclude. Thank you so much for everyone.
So, respected dignitaries on the dais and my dear friends and colleagues, I welcome all.
To a better life and better commitment in your future. Thank you very much for the patience.
Thank you so much. Thank you so much. Thank you, sir.
Thank
And
you,
once again,
thank you all.
wish you
Thank you
many,
so
many
much.
happy returns of the day. Happy
Let's meet
birthday.
again. Thank you, Anil. Thank you. Thank you very much.
Yeah. So, respected dignitaries on the dais and my dear friends and colleagues, I welcome all.
To a better life and better commitment in your future. Thank you very much for the patience.